Hello there, and welcome to today's episode of the Speech and Language Kids podcast. We are talking about fluency and stuttering, and in particular, I'm going to share with you our fluency and stuttering curriculums for speech therapy. So these are some pre-made pathways that you can follow in order to help a child or a teen who is stuttering or cluttering or has some other type of fluency disorder. So this is this whole season of the podcast of the Speech and Language Kids podcast. We're talking about all the different curriculums that we have, and I'm breaking them down into area. So we've already talked about speech sounds, language, social communication, and functional communication. So this is our fluency stuttering podcast. And then next is going to be our voice and resonance. So make sure you check out those other episodes as well. And if you would like to have access to our curriculum, you can go to speechandlanguagekids.com. Up in the upper right-hand corner, you'll see the sign in button if you already have a subscription, or you can hit the get the curriculum button to find out more information. So let's jump into our fluency and stuttering curriculums. These are our comprehensive plans for helping children who stutter. These include all of the therapy materials that you need, in addition to training videos and courses and a discussion board. We also have AI-powered material generators to give you extra practice materials. So lots of really great tools in here. But we specifically have 4 different curriculums for this area of fluency. So let's look at the types of children and teens that can benefit from fluency therapy in general and specifically from our curriculums. So the first one is children and teens who repeat sounds, syllables, words, or whole phrases when they're speaking. So it might sound like this. It might be a whole phrase. It might just be a syllable. So there's lots of different ways that can sound, but those repetitions is what we're talking about. It also might be a child who is having trouble coordinating their breathing with their speech. So they may be running out of air in the middle of their sentence, and they might have to stop and get more air. So that's the coordination of the breath and the speech. They may be having trouble with word finding. So they might say the wrong word for something or use a vague word like stuff or that thing. It also might be that they are elongating sounds or seeming to get stuck on them. So maybe it takes a while to get the sound out, or it could be that they get completely stuck and then nothing is coming out. And then finally, we want to include that a lot of times these children and teens get anxious or frustrated by their disfluencies. Sometimes it doesn't bother them at all. Sometimes it really does. So those are all different things to look for that maybe indicate that some fluency therapy would be helpful, and in particular our curriculums here. Now, these curriculums that we have developed, not only our fluency ones that we're going to talk about today, but also our speech curriculums, language, all the other areas, these were all designed from a team perspective in mind. And what I mean by that is I have a dream that all people on our team would be using the same resources. We'd have the same approach, the same supports. We'd all be speaking a common vocabulary so that we could support a child or a teen in a way that is more comprehensive because they're getting the same resources and supports from everyone on the team. So yes, this is designed for my speech language pathologists and my speech language therapists, however you are called in your area, but also our speech language therapy assistants, our SLPAs, and our parents and caregivers and our teachers and educators. So regardless of what your role is in terms of helping a child who has some fluency challenges, these programs can work for you, and we have specific training modules inside the curriculum for each of those different roles, including CFYs. I don't think I said that one yet. But we have different training modules to help you figure out how to use these resources in your specific situation. So make sure to check that out. You can go to speechandlanguagekids.com and click Get the Curriculum, and you can start a free 7-day trial to access these resources. That will also allow you to watch the training videos, and it will give you access to our discussion board so you can ask questions about how to use these resources. Okay. So let's talk about the 4 different curriculums that we have for this area of fluency. So the 4 curriculums, the first one is Foundations for Fluency. So this is going to include things like breathing and being able to coordinate your breath with speech, as well as your awareness and emotional reactions to fluency. So much of fluency, stuttering, cluttering, all of these conditions is about how you respond emotionally, because the more stressed you are, the harder it can be. And so that piece of it is really foundational to the rest of it. So if you are working with a client or a child or a teen who is struggling with either the breathing part of it or the emotional reactions part of it, definitely start there first. You don't have to, but it can make a huge difference in terms of how willing the person is to accept strategies and accept help. Okay, so that's one of them. And I'm going to go into all of these and break them down for you here in a minute, but I want to give you an overview first. The second curriculum we have is stuttering, and this is for our traditional, so to speak, stuttering symptoms. So this would be the repetitions, the elongations, the blocks, just the normal stuttering. Normal's not the right word for that. The stuttering that is kind of more classic. And I say that because the next one is cluttering, which is a different type of fluency condition. It's probably much less known. So if you haven't heard of that one before, that's okay. But basically with cluttering, it is a fluency disorder where the child or the teenager speaks so quickly and they're dropping off sounds or word parts. They're smushing words together. They're kind of muttering through it. But it's the whole key is that they're speaking too quickly, and they're ending up dropping some of those pieces out, and it makes it very hard to understand. This also comes with a lack of awareness, usually, where they're not aware that they're doing that, and so they don't understand why people don't understand them. So that's a totally different side of fluency that doesn't get talked about a lot, but we have a curriculum for that. And then the 4th curriculum in this area is word finding or word retrieval, which sometimes happens on its own, sometimes happens alongside stuttering. And so it's got different strategies, and we'll go over those too here in just a minute. But it's the inability to find your words or to grab the right word that you're looking for, and instead of saying different things. Okay, so let's go into each of those. We'll talk through some signs to look for that might be an appropriate curriculum to choose for a child or a teenager. And then I'm also going to tell you the 3 levels for each curriculum. So all of our curriculums are broken down into 3 levels. And that is because working on these skills at different ages and in different stages of therapy, it's going to look different. And so I want you to think of this as like a choose your own adventure book. So you're reading along and then you choose which of these pathways makes the most sense, which curriculum. And then you read along and then you choose which level makes the most sense. And then you read along and then you choose the skill that supports that level the best for that student. So it's like a flow chart. It's like a flow chart. All right, so we're going to talk first about the Foundations for Fluency curriculum. So this is the one that includes breathing and emotional reactions. So individuals that may benefit from this one of the things is if they are unaware that they are stuttering or having disfluencies. Sorry, my microphone looks like it's about to fall. So if they're unaware that they have disfluencies, this program can be great for that too, because this one does address awareness in there. If they are upset by their stuttering or disfluencies, if they are emotionally distraught about this program can help with that. If they're having negative thoughts about themselves, or if they have low self-confidence due to their stuttering or disfluencies, we definitely want to address those emotional reactions. If they are visibly anxious or upset when they're stuttering or having disfluencies. If they refuse to talk about their stuttering or disfluencies, that may be a sign that we need to look into this. Any struggles with coordinating breathing with speech or stopping in the middle of sentences or phrases to breathe. So all of those things are addressed in this curriculum here. So we have 3 different levels, and these are also kind of at different ages as well. So the beginner level is just working on that breath-speech coordination. So I have this at 5 to 8 years on our list here, and that is because that is the earliest that you would want to work on this, because a lot of times kids that are younger than 5 they don't have enough awareness and self-monitoring to really be able to work on the breath-speech coordination. It's a little bit tricky at that age. So I don't usually start working on this before 5 to 8 years, but you could definitely work on this with an older child or teenager who needs to work on breath control. So don't think that just because it says 5 to 8 years, you can't work on it with an older student. These are the ages when children typically start to master those skills. So that one is just coordinating the breath with the speech, and we have a whole packet, a workbook for that as well. Okay, intermediate level then is managing reactions to fluency struggles. And now we're looking at ages 7 to 10 years, because unless you've got a kid who's really good at talking about their emotions, they're probably not ready to go into this depth until they are about 7 to 10 years. But that's not to say that you couldn't work on it with a younger student, and definitely you can work on it with an older student. But we start off by just working on their awareness of their stuttering, and then we start to look at those negative emotions regarding stuttering, and we use some different strategies to reframe and, cognitive restructuring and trying to help them process how they're feeling about their fluency. At this point, I will also say, just like we did with our social communication when we were talking about selective mutism, make sure you are using a team approach with a mental health professional at this point, because anytime that we're dealing with big emotions like anxiety and stress, we definitely want to make sure that we are including those mental health professionals so that all aspects of this can be addressed. We don't want to have missed something that needed to be addressed by a mental health professional and then have it spiral into something bigger. So definitely make sure you're using a team approach there. And then the advanced level, we got 10 to 15 years and beyond. This is self-monitoring and carrying over fluency strategies throughout real-world communications. This is something that they probably will continue to work on up through adulthood. I will say also at this point, fluency beyond a certain point, there's many preschoolers go through periods of stuttering, then they just kind of come back through it and that never becomes a problem again. But beyond a certain point, fluency becomes a lifelong situation where your brain is just wired differently. And so fluency is different for you than it is for other people. And so at certain points in this therapy process, we want to give strategies, we want to give support, but we also want to back off as appropriate because we don't want them to burn out on therapy if they're not ready for some of these things. And so we do our best, but if it feels like we're not making progress or they're not interested in trying the strategies, if they're fine with their level of fluency right now, we can back off and allow them to have that space and then just let them know that speech therapy is always a tool that they have in their toolbox. And whenever they need more strategies, they can come back, but it's not something that's being forced on them because we don't want to leave a bad taste in their mouth in terms of therapy where they never want to come back and get more support. Okay, so that's just kind of a side note. We talked about that inside the curriculum on the discussion board not too long ago. Okay, the next one is Stuttering Curriculum. So this is for our actual stuttering. The signs that a child might benefit from this. We have our children that are younger than 5 years that have disfluency or stuttering that comes and goes. We can definitely provide some strategies to them. That looks very different than with older students because, like I said, those preschoolers often just go through these little periods of stuttering and then they come back through it and it's not a big deal. But that's included in this curriculum, the stuttering curriculum. You'll see in a minute, the beginning level is for the young children. It's that indirect therapy. Or if we're looking at older students, then we have that repeating whole words or phrases or revising what they were saying. We have kids that are using filler words like and and like. We have repeating parts of words or single sounds, elongating sounds, getting stuck where no sound is coming out. And then sometimes they will use movements or muscle tension to seemingly push through those moments of stuttering. So if you're seeing these secondary behaviors as well. So for this curriculum, we have our 3 levels. Like I said, that beginner level is the indirect therapy for young children. So this is ages 2 through 6 years. And basically what we do is we provide supports to help them speak more fluently at this age, but we don't necessarily jump straight into teaching them fluency strategies, because so many of the children in this age group will just kind of resolve it on their own. And we don't want to make it a big deal, because the more stressed they are about it, the more difficult it can be to get through that. So this part is indirect strategies that we can use, parent training that we can, help parents understand how to use these indirect strategies, of just reducing some tension, reducing some pressure, allowing them to speak through at whatever pace that is comfortable for them. And then if we want to move into a little bit more direct, we're working on things like teaching fast and slow speech, and teaching bumpy and smooth speech, and teaching them that it's okay to be bumpy and it's okay to be smooth. And here's some ways we can practice both. So it's a very non-aggressive way of talking about it. Once we get to ages 4 to 8, then we're looking at actually moving into direct therapy. If it is a child who is really, really struggling and they're super frustrated, or maybe they have a lot of risk factors like a family history of long-term stuttering and, there's all these other things happening, we might push to move to direct therapy a little bit earlier, more like the 4-year mark. But maybe we kind of wait and just see how they're doing, and that's closer to the 8-year mark. I know for my own son, he struggles with fluency, but it's never impacted him enough that we've moved to direct therapy ever. So he's 9 right now. So it's more of a as needed than it has, we're not here to say, oh, you're stuttering at the age of 8. You need to do these strategies right now. Well, if it's not impacting them and they're not worried and everyone can understand them, then no, they don't need to use those strategies. So intermediate level, then, we're working on teaching them fluency shaping techniques. These are techniques that are going to help them experience fluency, meaning that they are going to be able to speak fluently. And so we're teaching them strategies that make it more likely for them to speak fluently. And those are slow rate, easy onset, which is easing into our words, continuous voicing, light articulatory contact, and prolongation. Now, these are not strategies that we are expecting them to use all of the time. These are tools in their toolbox. And we're teaching them, hey, like if you're having a moment and you're really struggling, you can use one of these to just ease through your speech, okay? And then once they are comfortable with those techniques, then we can move on to stuttering modification techniques. These are a little bit harder to learn, so we often don't work on those until maybe 7 to 10 years and beyond. But again, you might have a student who is younger and is really struggling and needs these strategies. So keep all of these age ranges, take it with a grain of salt. But we're using actual techniques to help them either pull out of a moment of stuttering and get through that moment of stuttering, or prevent a moment of stuttering that they can feel coming. So there's the preparatory set. That's the one where you feel it coming and you get through it, or kind of prevent it from happening. A pull out would be if you're in the middle of a moment of stuttering and you're getting back out of it. And a cancellation is after stuttering has happened, you basically stop and restart, and you get around it that way. So those are the different strategies for stuttering, and those are the different levels for that curriculum. Okay, cluttering. Again, this is our students, our children and teens who are speaking very quickly, which causes their speech to become more disfluent. Their fluency improves when they're told to speak more slowly. This is a key here. If you are working with a child who stutters and you tell them to slow down, it probably won't help. It might, but probably not. If you are speaking with a clutterer and you ask them to slow down, and they actually do slow down, their fluency improves. You can understand them better. They might leave out sounds, word endings, and conversational speech. It sounds like all their words are running together. They use a lot of filler words like and like. And then they also will often revise what they're saying mid-sentence. And so they might say, I'm out of cheese. And so they start saying one thing and then they kind of change it and say something else. And then they talk around things. It's kind of hard to track the conversation because of all these disfluencies. Okay. So our levels for this beginner level is working on slow, clear speech. Again, we said it that they improve when they slow down. So we can help them understand what cluttering is and then learn and practice those strategies for slowing down and increasing their intelligibility. At the intermediate level, we're working on mastering those strategies. And that means being able to understand, oh, somebody's not understanding what I'm saying. I need to slow down and use my clear speech. And then at the advanced level, we're working on correcting those intelligibility issues in conversation. So using those things, those strategies as they are actually needed throughout the day. All right. And then our last curriculum for fluency is our word finding or word retrieval curriculum. So this is for our students who overuse non-specific words like that thing or stuff, or maybe they are struggling to come up with the word that they're looking for. They might say the wrong word. So they might say waffle instead of pancake, or toast instead of bread. My child says that one a lot, and then it gets really confusing when I hand him the wrong food. They might talk around words. So instead of saying apple, they might say, you know, that red fruit that grows on trees. So any of those kinds of issues can be helped with our word finding curriculum. So the levels here, we start off with semantic strategies, and these are strategies that help a child understand the meaning of words. And basically, the way I like to think of this is it's helping to organize words in your brain. Your brain has so many different connections, and it has all these little connections where electrical signals fly back and forth when we're thinking of things. And if we can't quite find that right pathway to that right word, then it doesn't come out, right? And so semantic strategies are organizing the words in your brain based on meaning. So we might talk about the categories of words. We might talk about words in a specific category. We might talk about the attributes of certain words or word associations. And so we're doing all these exercises to basically just give your brain more information about how the meaning of words are related. And that builds connections in your brain that makes it easier for you to find the word you're looking for. Okay? So that's one group. The next group then is phonological strategies. And so this is organizing the words in our brain based on how they sound. So we might be talking about the number of syllables in a word. We might be talking about what they rhyme with, and then using imagery while listening to words to connect the imagery parts of our brain with the word parts of our brain. Again, it's all about building connections in your brain. And then at the advanced level, we're looking at, okay, what strategies can I use when I'm actually having a word finding struggle in conversational speech? What strategies can I then use to help get me through that moment? Okay. All right. So that's all of our curriculums for fluency. Like I said, if you would like to access those, you can go to speechandlanguagekids.com and click on Get the Curriculum in the upper right-hand corner. If you don't want to worry about the subscription to our curriculum right now, I hope that this is still helpful to you in seeing that there are these different pathways that we can take children and teens down when they are struggling with fluency, that are structured plans, right? Not to just say, okay, well, let's work on this today, that tomorrow, just these one-off activities. That doesn't move the needle for our children and teens that we're working with. There are specific pathways that you could take that will teach skills in a progressive manner that helps them feel more fluent in their everyday life. Okay, I hope that's helpful. If you have any questions, you can email me at carrie@speechandlanguagekids.com. We also have a free 7-day trial, so you can hop in, try out the curriculums, come into the discussion boards and chat with me, ask questions, get some help, and hopefully we can find you what you need. All right, thanks so much for listening. I will see you on the next episode. We've got one left in this season, which is voice and resonance curriculum, so I'll see you over there.